Hello everyone, let's see about ectopic pregnancy. So what is ectopic pregnancy? Normally in any implantation should happen in the uterus. So how does this happen? In the uterus we have this ampulla as well as the fallopian tube. So again here we have the ampulla as well as the fallopian tube. This is the part of the fallopian tube. So when the ovaries release this ovum which travels to the uterus and the sperm is met, then the zygote is formed. So ideally the zygote should be implanted in the uterus endometrium. But if the zygote gets implanted anywhere other than the endometrium, then that is known as the ectopic pregnancy. What is the most common site where the ectopic pregnancy can get implanted? It is in the ampulla over here. This is the most common site. That is the ampulla. Now, how is it possible to diagnose ectopic pregnancy without ultrasound? We need to check the beta HCG levels. One knows that the beta HCG levels will increase during the pregnancy. But what is the rate of increase? Every 2 to 3 days, the beta HCG will double. If the beta HCG does not increase at this rate, that is, if the beta HCG levels does not double every 2 to 3 days, then it should lead us to the suspicion that it might be ectopic pregnancy. So why should ectopic pregnancy happen? What is the most common cause? Most common cause is pelvic inflammatory disease, commonly abbreviated as PID. So what happens in PID? In PID, there is a scarring. So scarring can happen anywhere, over here, anywhere the scarring can happen. Because of the scarring, the normal passage of the ovum and the sperm or else the zygote is somewhere disrupted and it gets abnormally implanted. The zygote gets abnormally implanted. Now, okay, ectopic pregnancy has happened. Now, what is the treatment? The treatment will depend upon the size and the gestational age of the ectopic pregnancy. If the ectopic pregnancy the size is less than 2.5 centimeters, and if the beta HCG levels are less than 5000 international units, then we can treat them with methotrexate. Methotrexate is the treatment. But anything which is other than these two criteria, like even if the size is bigger or even if the beta HCG levels are higher, then we should go for either laparotomy or laparoscopy. So when is laparoscopy indicated and when is laparotomy? The most common rule is if the patient is unstable, we cannot do laparoscopy. Anesthesia, the table tilting, the patient will not be able to tolerate all that. So the patient is taken directly to the laparotomy. So this rule is not only for ectopic pregnancy. Any kind of surgery, if the patient is unstable, the scopy cannot be done and laparotomy is needed. So this I want you to remember. The second one is if the patient is stable and if we know that the patient is having an ectopic pregnancy by ultrasound, and if they doesn't meet the two criteria such that methotrexate cannot be given, then laparoscopy can be done to remove the ectopic pregnancy. So this is in short about ectopic pregnancy. This much is needed for the NBME exams. Thank you for listening all this while. Have a good day.